I'm Mary Shaw. I'm the chair of physical therapy over at the university. And today I wanted to talk about exercising in the summer. But first I just wanted to talk about exercise among cancer survivors. Research has found that exercise is safe and feasible for most cancer survivors, and we're all survivors as soon as we start treatment. So it's important to get up and go. Initially, you're going to be going through treatment, which might be surgery, might be chemo, might be radiation, and you might think, oh, I need to rest. But as you've probably gone through when you've broken a bone or you've sprained an ankle, when you sit down and don't do anything, that inactivity leads rapidly to loss of muscle strength, leads to fatigue, your joints get stiffer, your muscles get stiffer, and it takes a lot longer to regain it than it does to lose it. So it's important to start exercising to improve physical functioning and fatigue and your quality of life. It might be, especially if you had been sedentary before you started getting treatment, that your intensity that you want to do it is not what you would do later on. So initially it's okay, 10 minutes a day, that's great, if you can just start with that. You may also have some time when the incision is sore or the internal organs are inflamed, but it's important that you get up and go. I was lucky when I had cancer 10 years ago. I had a dog who told me every morning I needed to get up and walk him. And so that got me out of bed, and initially, you know, I was surprised that my posture wasn't so good because of that incision, but you gradually get yourself up, you're able to get going, and that's important. And you will find some of the treatments may make you a little vulnerable, like survivors that are undergoing radiation should avoid chlorine exposure to the irradiated skin while they're undergoing that treatment. Or survivors with indwelling catheters should avoid, or feeding tubes, should avoid the pool or lake or ocean water to avoid the microbial exposure leading to infection. So, and then there are other precautions that you might talk with your physician about. A lot of us that have had hysterectomy or ovarectomy may have developed osteoporosis as a result of that treatment, or as well as the surgery or menopause. And your vertebrae and your hips are particularly at risk. So it's important to do weight-bearing exercise in order to reinforce the bone and keep it from becoming more and more osteoporotic. Other things that you'd be aware of is arthritis or neuropathy. Important to wear supportive shoes, use a cane, or use some kind of assistive device if you need it to reduce the risk of falls and injuries. Cardiovascular disease. You need to know your optimal heart rate, blood pressure, be aware of chest pain, drink plenty of fluids. You've got to be aware that, yes, we're dealing with the cancer, we're getting rid of that now, but you also need to be aware of what's happening in your heart. So many of the symptoms of fatigue and lightheadedness and dizziness may be due to dehydration in the summer, and you need to keep drinking your water. And some antihypertensive medications may affect your heart rate, so you need to avoid the overexertion initially. If you have anemia, if your platelets are less than 50,000 or your white blood cells are less than 3,000, you may find it difficult to fight infection. So you need to be aware of that as you're doing some new exercise. If your hemoglobin is less than 10 grams per deciliter, it can lead to fatigue and chest pain, so avoid strenuous activity if any of these apply. Now, 50 to 90% of cancer patients will experience fatigue during treatment, and 40% will experience fatigue after the treatment has concluded. So, you know, you're initially maybe thinking that it's all because you're having other problems with fatigue, well, sometimes it's the treatment. Still, 10 minutes at a time is something you can do. So as we start thinking about in the heat, you might think about moderate exercise versus vigorous intensity activity. So moderate might be biking on level ground rather than taking the hills, or doing spinning inside the YMCA or wherever you go and do your exercise, because there you are in a controlled atmosphere, you have less intensity of the heat on you. Other moderate exercises are general gardening, indoor tennis, walking briskly, water aerobics, yoga, circuit training. All of those can be done. And when I say moderate, it means that you can talk while you're exercising, but you can't sing. You maybe shouldn't be singing while you're exercising anyway. So strategies for exercise in the summer. It's important to exercise all year round. You know that if you take a break of exercise for even a month, that you're kind of starting back over with your exercising. So important to drink plenty of water. So dehydration will degrade your endurance performance, and the time to exhaustion is reduced even more in a hot environment. So carry the water, drink at least a pint of fluid for each pound of body weight lost during exercise. You may not be aware of that way at the beginning, way at the end, and just see how much loss of water you do in the heat. It will be different. In hot or humid weather, reduce the speed or resistance, because your target heart rate will be reached sooner. It may only last 10 minutes, whereas you were used to exercising for 20 or 30 minutes. But you already achieved your target heart rate, and it stays up there. Time can be gradually increased over a week or two as you acclimate to the heat. And then it will take longer to reach the target heart rate, and you can tolerate 20 minutes at that point. It'd be best if you could limit your exercise to the cooler hours of the day, or exercise indoors. If you are exercising outdoors, wear looser fitting clothes that wick, or lightweight clothing. Exercise with a buddy. I think that's particularly important if you're taking a long walk. Exercise with somebody else. They can help you out if you get in trouble. Take longer or more rest breaks to facilitate the heat dissipation. Avoid playing on surfaces that reflect the heat, like asphalt or grass. Better to be on ones that will absorb it and won't be giving it back to you. And warm up with a gentle stretch before warm up with a gentle walk first before you stretch, so that you can condition before you get to the exercise. Your muscles and joints are warmer at that point and can tolerate the exercise. So when you are in the hot environments, make sure that you're aware of some of the things that can happen, like exertional heat stroke. That's probably the most severe, where you become disoriented, unresponsive due to the hypothermia's effect on your nervous system. You become dizzy, have a headache, nausea, vomiting, and at that point your core temperature has elevated to 104 degrees Fahrenheit or greater, and you can actually have a stroke. So that's certainly the most extreme. A little bit less is exertional heat exhaustion, where you're unable to continue exercise. In that case, you might just have agitation. You don't become so hypothermic. Your temperature might go up a little bit, but it's not up to the 104. And in that case, usually the blood pressure is lower, but you have an elevated heart rate, as well as respiratory rate. Headache is typical. You may feel weak, dizzy, decreased muscle coordination. All of these are signs that maybe you need to stop. You need to find a cooler place to be in. Heat syncope is where your heart rate and breathing rate slow. And when you stand up, your blood vessels have dilated so much that all the blood rushes down to your feet and you faint. So that's called orthostatic hypotension. You tend to have pale skin, sensation of weakness. You might get a tunnel vision, so that it seems like everything around you is black and you're just seeing in the middle there. You might get dizzy or nauseous. And finally, exertional heat cramps. And again, this is because of the dehydration. You have an electrolyte imbalance. It begins with kind of localized muscle spasm, but then it progresses to debilitating cramps. Again, water is so important, and that's what you really need to be doing. Excuse me. It's important to continue aerobic type exercises involving large muscle groups to maintain or improve cardiovascular fitness. You can do slow dancing, you can do aquarobics, walking, good way to start. They don't take a lot of skill, and the intensity can be easily modified. Resistance training is also important for the osteoporosis prevention. So that includes free weights or machines with stacked weights or rubber resistance. The goal is to make your activities of daily living less stressful, physiologically as well as psychologically. And the resistance training becomes more important with age. So I think the bottom line here is find a place where you can beat the heat and still get moving. Join us for the Ramble every third Saturday. We won't be doing it in July and August, but the rest of the time, every third Saturday at 8:30 at Stony Point Shopping Center. We start at Panera's, and we walk a circuit all the way through this Stony Point Shopping Center once or twice, depending on your capabilities. We'd love to see you there. Thanks.